If a patient is getting friction or rubbing on the medial malleolus along the medial aspect of the brace can be heat adjusted in the office setting. There are pros and cons to doing heat adjustment. The con, or the negative side, is that once you adjust this brace or alter it with a heat gun or other measures, the brace itself will lose its warranty. The positive side is that a small minor adjustment in the office could instantly fix a fit problem and take away the delay in having to ship the brace back to the lab, have it adjusted at the lab, and then return back to your office for the patient. So a simple adjustment can often be made in the office setting that will solve a fit problem. And I'll show you how to do that. The first thing is you have to remove or loosen all the straps. You have to have some pliability to the brace, so you just simply loosen them. You don't have to take them completely out. And then remove the upright pad medially because you don't want to get this too hot. In order to create more room medially, we're going to create a little bit of a bend in the brace just under the upright, right under the upper part of the brace in this portion. So we're going to be applying a heat source there for about 60 seconds. Now, the timing of this varies depending on the dimension of the brace, but I'm going to give you a couple pearls of how to best do that. So we'll take a heat gun, and we're going to put the heat source just under the rivet and just keep it there. And as I'm heating, I'm pushing down gently, vertically on this limb upright. There'll be a point where you'll feel the limb upright start to move because the plastic is now pliable. It takes about a minute. So I'm putting some heat. You don't have to move it around too much. And I can already feel the plastic getting softer because the upright is starting to move a little. I'm going to need about another 20 seconds or so here. And I'm feeling it start to move. Okay, that's about right. So what I'm going to do is I'm going to stabilize this brace and watch the medial side move out. See how easily that moves out? And I'm just going to hold now for about another minute and just let it cool off. And what we've effectively done is created more space medially on the brace. Of course, it's better to do this in small steps or in increments because you don't want to over widen the brace and then you lose correction. Once you note that the adjustment is holding, we go ahead and reattach the limb upright pad and the straps. Take the brace into the treatment room, have the patient try it on, and walk up and down the clinic floor. In many cases, that simple adjustment of perhaps 1/8 of an inch is enough to completely solve the friction problem if there is one. If it's not, you can go back and reheat and push out a little bit more. But the bottom line is do this in small steps and don't overheat and over adjust because you may lose control.